Okay, today we are going to be introducing you to our two inspiratory muscle trainers. These are new devices that we are introducing to not only our lung transplant program, but also to our patients who are with tracheostomy. And our overall goal is to progress these patients off of the ventilator and off of their trachs. These work to strengthen the inspiratory muscle groups and overall advance their activity tolerance and breathing capacity. So before you start with any IMT training session, of course you want to perform your proper hand hygiene and be handling the devices at all times with clean gloves. First and foremost, the patients who are contraindicated for this training are those who have an active air leak or pneumothorax, or patients that have bronchial dehiscence or have placed a bronchial stent. Those are the patients that we will not be using these devices with, and if they were previously under IMT training and developed these conditions, it will be discontinued and the devices will be thrown away. So we have two distinct devices, the Smith's Medical device and the Respironics device. The Smith's Medical device has different size resistors that are placed to one end of the T-piece. This device is geared towards our lower level patients, those who maybe don't have quite the capacity for the full diaphragmatic breathing program, or who are just not strong enough to tolerate the higher level device. When you unwrap the Smith's Medical device, you will see the T-piece here, and it has three ends. You will assemble in order to provide the mouthpiece, and on one end you have the attachment for supplemental oxygen. This device can also be fitted to a directly to the tracheostomy, which we will show you shortly. On the other end of the device, you will place the resistor. These resistors come different size millimeter of openings on one end of the resistor, and they are progressive. The sheet that comes in the packet will bring you through the levels of which the resistance goes from easiest to hardest. As the size of the opening decreases, it requires more and more strength to draw air through the resistor piece. And as you start to work with these patients, you'll start on the easiest, measure their response, which we will go over, and progress them through the levels to where you hit a moderate difficulty level. Both devices also come with a nose clip. We are placing this on the nose at the base of the nostrils so that we are really localizing the effort through the oral cavity. For any training session, the ideal position would be 90-90-90. So trunk at 90, hips at 90, knees at 90. Ideally, that would be either seated at the edge of the bed or in a bedside chair, but if it's necessary, raising the head of the bed up to 90 degrees will suffice. So we will start by introducing you to the Smith's Medical device. Of the two trainers we have, the Smith's Medical device is for our lower level patients, those who are lacking the strength at a higher tolerance or don't quite have the pattern of the diaphragmatic breathing yet. They don't have that pattern down yet. So again, both devices can be attached directly to the trach. In order to do that, when you have your pieces, you will affix directly to the tracheostomy. Again, you have the port here for if there is any need for that supplemental oxygen during the training. Your resistor piece will be affixed to the opposite end of the T-piece. And when you initiate the first set, you will apply the nose clip to the base of the nostrils. From there, you will instruct them to take a goal of 10 breaths, 10 respirations per set. If they need a break between each one, which is recommended, the piece can come off directly. to give them a break. They can breathe normally for however long they need to recover, and then you will replace both in order to bring them through each of the sets. As you progress through the different levels, we are aiming for a moderate level of effort on the modified Borgnesia scale, which I will show you as when we initiate a full training session in one of the following videos. You can progress down the levels of difficulty, and this comes with the Smith's medical device in the packet with you, and we will keep this with it at all times. So you can run through the difficulty levels. As the size of the opening at the end of the resistor becomes smaller, the effort required to draw the air through will become greater and greater. Ms. Smith, I'm going to show you how to do the diaphragmatic breathing. It's a fancy way of saying belly breathing. One of the keys to this training is to develop strength in the big breathing muscle, the big diaphragm that sits at the base of your lungs. When you inhale, we want that muscle to expand down, which leaves room for your lungs to expand. So I'll show you how to do that. First, you want to concentrate your breathing in through your nose and out through your mouth. And as you inhale, try to expand your belly. So when you inhale, the belly pokes out, and you exhale through the mouth, let everything relax back down. Good. You can also help the patients learn how to belly breathe or breathe diaphragmatically by giving them some tactile feedback. I will place one hand on your chest and one hand on your belly. Ms. Smith, when you take a deep breath in, I want you to poke your belly hand out, okay? So breathe in through your nose, poke the belly out. Good, exhale through the mouth and relax down. Good. A lot of times we see the patients breathing in the shallow tops of the lungs, so that tactile placement and the cues to lead them through a belly breath can be extra helpful. And the diaphragmatic breathing is the technique that we will be using to begin the training. For those patients who do not have that pattern down yet, I would suggest starting with the lower level device, the T-piece via the Smith's Inspiratory muscle trainer. And as they get stronger and can handle higher resistance load, you could move and graduate them into the Respironics device. So, Ms. Smith, I will be starting you on the lowest resistance level. These are going to change as you can tolerate it. We are going to be going based off of the level of difficulty. Okay, Ms. Smith, this is a dyspnea scale. It shows us a scale of 0 to 10, how difficult it is you feel it is to breathe. Right here, before we start, what level would you say your difficulty of breathing is? Very, very slight, okay. So I will record that before we get started, in addition to the baseline vitals, which we will go over in a later video. Okay, after each set, I'll check in with you and see how that went. This is the nose clip. I will place it on the base of your nose, and this is just your mouthpiece. So this will be how you breathe in as with the diaphragmatic breathing like we practiced, that belly breath. Are you ready? Yes. We'll do one set of 10, and I'll check in with you after that. Is that okay? All right, I'll hand you that. So breathe in, belly breath, and you can breathe out through the device. Good, that's 1. Good. Keep going through 10, okay? We are monitoring for continued belly breathing as best that the patient can manage. If they are breathing rapidly, we will cue them to slow or even to hold the breath for 1 or 2 counts. We want a slow, deep, controlled, and drawn out breath instead of very quick, shallow breathing. When the patient gets to 10, you can remove the device and the nose clip, and we can have them check in. So Ms. Smith, how hard was that? Moderate, okay. So we're at a moderate level. We will continue 4 more sets with breaks in between at this level. If you're using the Respironics device, you do not have separate resistor attachment pieces. The resistance level is set by twisting or untwisting the spring-loaded resistor internally. The nose clip will be applied to the base of the nostrils. That wants to stay. If attaching via the mouthpiece, it is as simple as bringing the mouthpiece over the resistor piece and providing through the mouth. If providing the training directly to the tracheostomy with the Respironics device, you have additional pieces that will be provided by the respiratory therapist. To assemble this, you will bring the trach attachment piece and open the skinny end to the first skinny connector. You will use the smaller diameter connector to connect to the larger diameter connector. And the larger diameter connector will then be attached to the training device. This is your flexible tubing that can then be applied directly to the tracheostomy. The nose piece again will be applied and the sets of training can begin. The goal will be to provide one of these inspiratory muscle trainer devices within 24 hours after a tracheostomy is placed. It will not occur sooner than that, so after that first 24 hours, they are considered cleared to initiate the IMT as long as they do not meet one of the prior contraindications: pneumothorax, air leak, dehiscence, or bronchial stent. Throughout the training sessions and at the beginning and end of each training session, we will be monitoring a certain set of vital signs. These are not only to guide the therapist or the exercise physiologist how to gauge the patient's response to the treatment, but also to appropriately progress the patient through the training, as both devices are progressively resistive. The Respironics is via the twisting resistance, and the Smith's Medical is with the different resistor pieces attached to one end of the T-piece. Clinical signs of poor tolerance would be desaturation, as well as either tachycardia or bradycardia, and if they are experiencing unrecoverable dyspnea or severe dyspnea. The target level of difficulty or dyspnea would be at the moderate level, so either a 3 or somewhat severe, 3 or 4. If we reach that level, that will be your target level of difficulty for that level of resistance. When you reach that during the session, you will complete a certain number of sets based again off of their continuous tolerance monitoring, either via their clinical signs or just through their level of difficulty. So you will provide their incentive spirometer, you will instruct them to take a large deep belly breath or diaphragmatic breathing, and you will take the best of 5 repetitions. That is their baseline pre-treatment. You will record their at-rest dyspnea, their SpO2, the heart rate, and the blood pressure. So you will measure all of those, plus the best of 5 trials on the incentive spirometer, both before and after the session. During the session, you are continuing to monitor their level of dyspnea, their oxygen saturation, and their heart rate. Other vitals can be assessed as indicated. When you initiate the session, you will take your baseline vital signs and leave the patient attached to the Dynamat. That makes continuous monitoring very, very easy and hands-off. You will introduce the device to the patient if it is their very first time, and if it is the very first session, or for any reason that you are going easier in the resistance level, let them know what level of resistance they are starting at. You will Bring them through the first set of 10 breaths, and based off of their dyspnea and their tolerance level of that activity, you can progress through the levels of resistance until you hit the moderate or somewhat severe level of dyspnea. We do recommend, based off of the evidence provided in the literature, sets of 10, a minimum of 4 at the target level of difficulty, all the way up to 6 sets. So either 4 to 6 sets of 10 breaths with the device attached and the nose clip in place. We will monitor vital signs throughout that to determine whether they could go all the way to 6 or 4. If they have reached 6 and they're still not quite at the level of dyspnea, then we would recommend progressing the next session to the next level of difficulty. For the Smith's medical, that would mean starting at the 7 millimeters and working your way through the color coordinated resistor pieces. For the Respironics device, that would require twisting to the higher level of resistance via the spring-loaded resistor that is internal to this device. They will probably require some rest in between each set. If it's on the trach, you would remove the nose piece and detach the device from the tracheostomy. If they are on a trach collar at that time, put that back on. Give them about up to 2 minutes of rest is ideal. The shorter the better, but again, that can also be a way to progress the patient through the training with either device. Rest can be up to 2 minutes, and we are trying to minimize that as they get stronger. The devices will need to be cleaned periodically. The pieces will become detached and they can be washed with warm soapy water, and for drying purposes it is recommended to be left out to air dry. Try to find an unused water pitcher with 1 or 2 paper towels on the inside just to absorb, and make sure that the pieces are all disassembled and able to air dry. You are looking for condensation inside, or if any of the pieces become visibly soiled, that would be your indication to go ahead and wash and let air dry. We recommend an unused water pitcher because it has airflow, but it also has the lid on top to be able to air dry appropriately. Once dried, or if the pieces are all clean, the devices and all of the accompanying handouts, including the copy of the modified Borg dyspnea scale, will be stored in a bag labeled with IMT and the patient's name. Look for them either in the cubbies or preferably hung within sight and with the drawstring closed. So to enter the charges and the documentation, currently the dot phrase is .imtpt. You will be able to pull up this template and it's pre-filled. You will initiate, whether the confirmed no presence of the stent or the air leak, and then whether it was affixed orally or via the tracheostomy. And then you can enter the vital signs as shown. You have the pre-training and the post-training information, as well as the different levels of resistance. This is the template for the Smith's device. If you didn't get as far as the higher levels of difficulty, or if you did not train any of the easier levels of difficulty, you can delete rows as necessary and just include the levels that were trained on for that particular session. And then after that, you can sign it. Currently, charges can be entered as neuromuscular education, and however many timed units you were there spent during that training.